Access to comprehensive, confidential sexual and reproductive health care is critical to support young people as they grow into healthy, productive adults. Last fall, I worked with fellow adolescent researchers and pediatricians to share what we had our eye on in terms of access to sexual and reproductive health care for teens. Today, our concerns around high rates of sexually transmitted infections among youth and uptake of the HPV vaccine remain top of mind, among other issues. At the same time, funding for programs that support young people's access to sexual and reproductive health care, like Title X and Medicaid, remains uncertain. And that's already affecting access to care, including here in Pennsylvania. Some clinics have had to scale back family planning services for patients with Medicaid coverage, and clinics that were once able to provide low-cost, confidential care under Title X are no longer able to do so. We're also seeing that uncertainty itself can make a difference. It can shape how young people access care and how providers are able to deliver it. Medicaid and Title X programs are key resources for adolescents and young adults and the providers that serve this population. They help connect young people to services like contraception, screening for sexually transmitted infections, and other preventive care, like screening for cancer, in settings where their confidentiality is protected. And when these programs shift, even in small ways, it can have ripple effects on teens' health. Young adults may find it harder to stay covered, especially when more complicated processes are introduced, like increased administrative requirements in Medicaid, and providers that offer valuable, free, confidential care, which decades of research have shown to decrease risk of sexually transmitted infections and unintended pregnancy, may scale back their services due to funding cuts. This has ripple effects and adds up to less care for young people who need it. Even so, there are opportunities to support young adults in other ways and fill gaps in care by continuing to prioritize our confidentiality, including through health coverage policies that don't share explanation of benefits of sexual and reproductive health care services with guardians, by creating more touch points for adolescents to access sexual and reproductive health care, like offering contraceptive care in the emergency department, and by making sure that young people have clear, reliable information about where to go for services they can trust, including through strengthening clinical community partnerships and accurate and comprehensive school health education. By focusing on these areas, even in a period of uncertainty, we can help adolescents get the care they need when and where they need it.